Here's the agenda for today. We've got the local COVID update from our Director of Public Health, Anna Hartley. We've got a roadmap update from Sam Walters. We've got Joanne Fitzpatrick joining us from the CCG, who will give us an update on vaccines. We'll build feedback on gauging the mood of the community. We have some learning and development opportunities you may like to take part in, and some roadmap resources. So over to Anna.
Thanks, Tracy. That's great. I'm sorry, let me just do that. So welcome everybody. And unfortunately, I am going to have to leave after this presentation, because when you see my presentation, you'll understand why. But as always, it's really nice to be on this call and really great to see so many participants. So next slide, please, Tracy. Yeah, so sorry, this is a bit blurry, my fault, because I sent it to Tracy about 2 seconds before the meeting started. But this is kind of the hot off the press data that I like to share on a Wednesday, because quite a lot of our sort of reports come on a Monday, but by Wednesday the pictures change. So I like to give you guys like the really up-to-date data. So just to share that Wakefield's now at the unvalidated data is 730.4 per 100,000, which is by a long way the highest figure I've shared with you. However, yesterday it was 737.8 per 100,000. So for the first time in a few weeks, we've seen a very small reduction, very, very small. But anyway, let's just take our positives when we can. And if we look at the Yorkshire and Humber picture, we're now running at a 621.2 per 100,000 average rate across Yorkshire and the Humber, which again I think is probably will be our highest rate ever. And the same with even England, which is generally quite a lot lower, is 520.4. And if we look at that from just a week ago, that's gone up from 360 per 100,000. So what we're seeing is still that very, very fast rate of increase, and that is very concerning. And we know that's now starting to put pressure on our health and social care system, and particularly you'll have seen probably in the media, Mid Yorkshire Hospital is under some pressure. So next slide, please, Tracy. Yeah, so that slide just says it all. I mean, look at that line going up at the end, and that's higher than the November peak, although just a little proviso, which all of you are probably armchair epidemiologists now, or I hope you are after a year of listening to me talk, but obviously that's not cases, that's positive tests. So what we don't know is if in November as many people were getting tested, and because we've done this big drive to get people tested in Wakefield district, you know, we are finding those cases. So that's my only little ray of hope, that we're finding those cases, and possibly you know, it may be that we had higher case rates in November but we didn't know about it. Next slide, please. So I don't always show this slide, but again, it's just really well, it's not, I suppose it's fairly common sense that when our rates go up, our positivity rates go up. So that's for every 100 tests we send off, how many of those come back as positive. And when things are good, that's probably less than 2%, but now that's gone up to 15%. Although that's kind of, you can do some sort of amateur detective work around that, where back in November, I think that was 20%. So it's still a bit lower than that, even though our rates are higher. And that does imply that we're doing more testing, because obviously the more testing you do, it's likely that your positivity levels are lower, if you see what I mean. So that's probably indicative of the fact that we're doing slightly more, well, considerably more testing than we were back in November. So that's good. So anyway, next slide, please. Yeah, we can just go on to that. Oh, just sort of sorry Tracy, go back. Sorry, that was me, I just missed that. So interesting around positivity by age group. So that yellow line is your 17-18 year olds, which we know is a group that are having much higher rates, and not surprising, they're also seeing much higher positivity. So in that age group, around 50% of the tests that are getting sent off are coming back as positive, whereas when you've got your 80+ group, about sort of 2% are coming back positive. So that's kind of what we'd expect. It is still a bit worrying. Next slide, please. So this is like a slide you won't have seen before, because we've never been in a position where our rates are as high as this, and you can see that in that younger age group we've got, COVID has completely finished my eyes off. I don't know if anyone's in that position. I had perfect eyesight before COVID and now I really don't, but squinting to see, I think that's when we look at our 17 to 18 age range, we can see a rate of 1,754 per 100,000, which again is just we would just never would have believed we could get that high. So you know, it's what's worrying is that even in that older age range, so that 60 plus age range, where we know that nearly all of those people have been vaccinated, that number's going up. And just to explain a little bit about that, and Joe's obviously going to talk about vaccination, so I won't dwell on it too much, but we know that there's no vaccine that's 100% effective, and also different people will develop a different immune response. So and it tends to be that the older you get, the less good your immune response is, and obviously that's a generalization. There'll be people that develop a very good immune response at an older age. So when COVID rates remain low, those people are more or less protected by the fact that rates are lower. However, when rates get as high as this, you can see that those positive rates go up, and some of those people will have been double vaccinated. So I think it is still that message we've had all along around being cautious. So if you were so I would be saying to people, if they're in that older age group and they're more vulnerable, they've been double vaccinated, fantastic, but absolutely adhere to those kind of other things that will keep you safe. So avoided crowded spaces, you know, hand washing, all of those things, because you know, you with rates as high as they are in the district, you just put yourself at a little bit more risk. Next slide, please. So this is just a really interesting slide that our team did, and I just like to share the odd different slides with you every week. So what this slide shows is the impact on education in Wakefield, and the blue lines are those that are absent from COVID, and the orange lines are those that are absent because they're isolating as a contact. So whilst the contacts are much more significant with schools, because often you'll get so any of you who've got kids will know that when the bubble pops, that's 30 children or sometimes 60 children get sent home, whereas obviously for somebody like myself, if I was positive case, I'm not seeing anyone, it would have a very limited impact on the contacts. But it just gives you a bit of an indication of what schools are having to cope with at the moment, and what the impact is for Wakefield families. And obviously the guidance changes on the 16th of August, so you'll no longer have to isolate if you're a contact and you're a child, or if you're an adult and double vaccinated. But that slide is kind of really sort of quite interesting, isn't it, in terms of that impact on schools. And just if anyone knows any teachers, they've had a really rough 18 months, so we all need to be nice to them, because it's not been an easy time for them at all. Next slide, please. So again, I just show you this slide and what it shows you. Rates are really high. There's no Southend's a little bit higher this week, probably will look different next week, but there's no particularly is pretty standard across the area, apart from that little patch between Pontefract and Featherstone. So yeah, if you live there, great. Next slide, please. And again, I just show you the common exposure events, and it's exactly what you'd expect. You've been on these calls long enough. Big common exposure is education. That doesn't mean that exposure is happening within education. We all know that young people are mixing outside of schools. It just means that young person has identified that they've been in school that 2 to 7 days before becoming infected. But we are seeing that workplace bubble go back up again, which we'd seen go right down again. Again, very difficult to say whether that is happening within the workplace or whether it's just community transmission. So therefore people are going into their workplaces. And I suppose if you were to think about it logically, those numbers have gone up since the social restrictions reduced. Actually, workplaces are pretty much remaining as they always have been, with significant restrictions in place. So actually, we know that social contact is far more risky, because you don't tend to kind of go into work and kiss all your co-workers and give them a hug and spend time talking to them. Well, Joe's raising her eyebrows. Some people do, and that's lovely, and if we all worked in places like that, maybe the world would be a better place. But actually it's that social contact, that household contact, that is definitely much high risk in terms of that infection being passed on. Next slide, please. So hospital admissions, we didn't want this slide to look like this. You can see those numbers are really starting to go back up in hospitals, and we know that when admissions go up, then deaths tend to follow. And although the very successful vaccination programme has mitigated against that. We also know we do have some people in Mid Yorkshire who are quite poorly now. Either vaccination, you know, sadly the vaccination doesn't work for everyone. Some people have chosen not to have it, and those people are sadly more at risk. So you can see, just trying to add that up, that you've got about 44 people in hospital. Now that's gone up, I think that will probably be more. I don't know if anyone knows, Joe, I don't know if you know the exact number, but I know it's gone up to 46, I think, by after the weekend, and I'm sure we'll see that number continuing to rise based on the data that I've just shown you. Next slide, please. And then
sorry, Anna, 52 was mentioned in District Gold this morning.
Oh, thanks, Andrew. So yeah, you can see how that number, it's not going up anything like as fast as it went up when we didn't have a vaccinated population. So Martin, so I was on BBC Radio Leeds on Monday. I'm only saying that not to boast about being on BBC Radio Leeds, but because I was supposed to be on at 7:05 a.m. and I got up very early and was like drinking coffee to try and wake myself up, splashing my face with cold water. And then I was bumped for Martin Barkley, who was on at 7:05, and they bumped me to later in the schedule. And I listened to Martin quite resentfully, it must be said. And Martin was saying that back in November they'd have had about 300 patients in hospital with COVID, and they've got, you know, 54, I think Andrew just said. So it is the vaccination programme has been fantastic, and it has massively reduced that impact. However, it's never going to be 100% you know, effective, because life isn't like that, sadly. So I would expect next week to start seeing some of that maybe though that death figure to increase a little bit, because we know we've got some really poorly people in hospital. So next slide, please. Yeah, so that's the end of my presentation. So I'm going to head off now, but thanks everybody as always, and I know there's some really good presentations still to come. So see you next Wednesday.
Bye. Thank you very much, Anna. Thank you. And now we've got Sam Walters, who's going to give us an update on the Step 4.
Good morning, everyone. Thanks, Tracy. So what I've done here is I've lifted literally the wording from the government website about Step 4. So all of this information is on the government website. It is a bit repetitive, and I do apologise, but it's just to summarise where we are at the moment with Step 4, and clearly we moved into that on Monday. So you can see for yourself there, we've got we have got cases, as is just what's been demonstrated from Anna. We do need to act carefully and remain cautious. Can I move to the next slide, please, because it is quite repetitive, I'm afraid. Okay, so the restrictions have been lifted. I am going to just give a caveat to that, because just like what you've just heard, the law, in effect, the majority of the law is gone, but the risk hasn't. So in terms of the law, most legal restrictions have been lifted. This means you don't have to stay 2 meters apart from people you don't live with. There's no limits on the number of people you can meet. However, that does come with the caveat that we do need to be really careful, and we do need to think about, and it's about this acting responsible, each and every one of us, that the obligation is being passed back to us as individuals and also on to businesses, and that would include any setting. So it's going to include hospitals, it's going to include workplaces that we all work for, it's going to include when you go out and visit a pub or you go to a nightclub. All of those individuals have got a responsibility. Now, the instructions from government is you should meet outdoors where it's possible, and there's a big thing around letting fresh air both into homes and into businesses. They're no longer instructing people to work from home, as you will have seen on the news. However, there is an expectation that doesn't mean that everybody rushes back to the office. And certainly before you do, some of the slides that I'll come on to shortly, there needs to be what's called a risk assessment that needs to be put into place. We know that the requirement to wear face coverings in law has been lifted. However, the government's expected that most people will wear face coverings in crowded areas such as public transport. And many of you may be aware that our Mayor, Tracy Brabin, has required that in all West Yorkshire, in the bus stations, train stations and on public transport, that masks are worn. At the moment, I'm not sure of the legal status of that decision. However, that is the instruction, very much like what's been required in London, and others are looking to follow. And what you may find as well is that many businesses also are requiring that, and they are saying if you can wear a mask, then you should be wearing a mask, and that includes big supermarket chains. It includes I think WH Smith's, Waterstones, quite a few have come through. They are facing a bit of backlash over that, but what they're doing is complying with what I'm going to talk to you about just shortly. There's no longer limits on the number of people who can attend weddings, civil partnerships, funerals, etc. And there's no requirement for table service. So you no longer have to go into a bar and sit down and order your food, although many are maintaining that service. And there's no restrictions on singing or dancing, and there is some guidance out there to reduce risk, which you should have regard to. Can I go to the next slide, please? So there's a lot of information crammed onto these, but basically we know nightclubs can open, hospitality venues, like I've said, no longer table service. But this is the key point for everybody, is that on the government website now, there is principles set out in what's called the Working Safely guidance. Now, what's happened is for each of the relevant businesses, so it looks at offices and shops, it looks at hospitality venues, it looks at events, sporting, there is guidance there that all of those types of businesses should have regard to, and they should work through those documents and assess against them if that's really something that they can comply with. The government stance, what's coming through is, you need to justify as a business if you're going to change anything from how it was in terms of what's happening inside a business. So in terms of social distancing, etc., you need to be able to justify why that's safe. On every single business, there is a duty placed under law, under Health and Safety at Work Act law, that you have to protect the health, safety and well-being of not only your staff, but of anybody that is affected by that business. So if you are a hospitality venue, you are responsible for the health and safety and well-being of anybody who comes into that venue as well. Given that COVID affects health, then you have to put in measures to try and mitigate or reduce those risks. So this is what you'll see here, where they were saying about a health and safety risk assessment, and it has to consider the Working Safely guidance. If it doesn't, and someone does get affected by COVID and it's linked back to the workplace, then you could get severe penalties. It'd be very difficult for us to prove exactly that, given that it's in the population, we can see where the figures are in Wakefield, that the person actually contracted it through work. However, there could be a situation whereby people have tested negative, they've all been together on one shift, and then everybody has suddenly gone down with COVID, they're all testing positive, and we may be able to link it back to that time and say, actually, this was caused by work and not having enough measures in place. What runs through this safety guidance really is these major 4 points here. One is about cleaning surfaces that people touch regularly. We've got to identify poorly ventilated areas in the venue and take action to improve airflow. We've got to make sure that staff and customers who are unwell, as much as we can, don't attend that workplace or venue. And we've got to make sure that we communicate to staff and customers the measures that you've put in place. And when you've gone through your risk assessment, you've got to explain and justify why you're putting a measure in or not putting a measure in. You will see, and there has been discussed about this NHS COVID pass. It is at an early stage, but it was I think it was Monday that Boris put this back on it's been bouncing backwards and forwards, but they've put it firmly back in as a condition of entry from September. What the idea with that is that they're going to give enough time for everybody who's over 18 to have had the opportunity to have had both jabs before they bring this in. Once we get to September, the idea is there will be this pass. What that will look like, we've got to get a little bit more information, but you can see that information there, and it will be available through the NHS app, or they are saying there's going to be a letter that you can have to show. Obviously, it's all open to fraud, so they're going to have to look at that and see how effective that is. QR codes. I know we've had a question about QR codes. So the situation that we've got at the moment, some businesses are wanting to maintain them, some aren't. You may have heard that the Sun has been referring to this situation as United Pingdom because of the amount of people who are being pinged by the app. It's causing significant issues for many industries, including the police, food manufacture, supermarkets, travel, and there are some regulations due out shortly allowing some flexibility, but it's a very limited flexibility to try and keep England moving. And we're going to have to see what the detail is in that, because it came out yesterday from government and the detail is yet to follow. That will, it doesn't allow people to be totally exempt from rules, but it will allow people to potentially work, but under strict conditions. And what I expect in a couple of weeks, I'll be able to come back and share more detail with you on that situation. Next slide, please. So I think just this, as I spoke at the beginning of this presentation, it is about each of us. It's about each of us and how we progress through this next stage. We are conscious, and I know Tracy will go through a questionnaire, and it is normal that people are feeling quite anxious. There is some information on the government website about how to cope with anxiety, and there is a link in this. But we have to, we can all take actions to make things a little bit better and to protect ourselves and others around. And this all comes with wearing a face covering if you can. That protects others, not yourself. And fresh air. You know, if you're going to have people around your home, you're going to have quite a few, think about fresh air, try and meet them outside if you can. And it does give a few pointers on there for things to consider. I think the next slide is my last slide. So yeah, that's just very repetitive. It just talks about how COVID-19 can pass on, which I know you're all familiar with. Sorry, there is one last slide. So just one of the questions that does come up is around clinically extremely vulnerable. As you are aware, the shielding has stopped. However, lots of people are concerned who do fall into the clinically extremely vulnerable category. There is some guidance out there for if you find yourself or you have any employees who find themselves who are clinically extremely vulnerable. There has to be a risk assessment done for every one of those individuals, and it has to be done on a case-by-case basis according to what they do, how they work, can they work from home, can they return to the office, and there has to be measures in place to make sure that those individuals are protected as much as possible. That goes along with everybody else, but you do have to consider those extra cautions. Sometimes they did suggest yesterday that maybe the consultants that maybe people are under may be able to give a bit of guidance to help steer the workplace with any particular measures that need to be in place. But that's certainly, there is guidance there, and I would urge you to look on the website and look for the clinically extremely vulnerable guidance that is there for everyone. And that's it from me.
Thank you very much, Sam. I'm not sure if you can still all hear me because my screen is just well frozen, but we have got Joe Fitzpatrick with us from the CCG. I've got a slide here about getting the jab done, which shows how many people are being vaccinated, and I believe that Joe's going to share some slides with you too. Is that okay, Joe? Can you hear me?
I can, yes, Tracy, thanks very much, and thanks everyone. I realise that I've not been here for a very long time, so I thought I'd just give you an update. I know Anna's been providing updates on a regular basis with you around the vaccination programme. So for those that don't know me, I'm Jo Fitzpatrick, and I'm the Senior Responsible Officer for delivering the vaccination, the COVID vaccination to the population of Wakefield. The eligible population, it's about 308,000 people that we need to have double vaccinated to give the best protection that we can against the COVID virus. So I'll just share my screen if that's okay. So hopefully it'll share the right one. If I click that one, has that shared a PowerPoint to you all? Yes, good.
Yes.
I'm not quite used to Zoom, so so it's getting used to them all different ones. So So in terms of progress to date then, so we do the getting the jab done, which releases out on social media that Tracy just shared there. And we use that information, that data from the national website, but the figures that I'm sharing with you today will look slightly different because we use these from the general practice clinical systems. We do a search, an anonymized search of the clinical systems to find out how many people have had a jab and what demographics they fall under, and where they, where the areas in which people live, so we can see uptake by GP practice as well. So in terms of who's had a first dose of vaccine, that's now 254,000 out of that 308,000 of eligible population in Wakefield. And that's 82%, which is really good. And I'll share you the West Yorkshire figures in a moment so you can compare Wakefield to the rest of West Yorkshire. And of those, 66% have had 2 doses of the vaccine, which is about 204,000 people. And obviously they've been going at each cohort by age and by vulnerability or high risk has been invited in at different stages. So we've still got people to complete the 2-dose course. I am going to stop putting complete course because I will be coming to a later slide which talks about the 3rd dose, which is the booster vaccines as well for certain people that will be coming along in the autumn. So at the moment, all people aged over 18 are now eligible to come forward for a vaccine. And you will have potentially heard, I don't know, earlier in the week about the plans to start to invite 12 to 15-year-old children that are either vulnerable themselves with certain conditions or that make them higher risk of poorer outcomes if they catch COVID, or indeed if they live with somebody who is clinically extremely vulnerable. We're just awaiting the guidance on that, so that we're not actively vaccinating yet. We've got to wait for all the regulations to catch up. Sometimes a little bit of a challenge for us because the news goes out and the guidance doesn't, and the regulations allowing us to do it don't follow very quickly afterwards. So we are still awaiting the guidance to come out to enable us to do that, but we're going to get that done as quickly as we possibly can as soon as that guidance comes out. So we've got a mixed delivery of models across Wakefield, very successful as well. With what we are in Wakefield, we all work together. We're all very responsive as well for changing patterns, which I'll come on to in a moment. So we've got various providers that are giving the vaccines out there. So when you go to a site, you might not know whether it's a hospital trust that's running it or whether it's a GP practice, a collaboration of GP practices or community pharmacies. But we do have various people that are giving those vaccines out there. And also what we are doing is we have a roving team now with pop-up and walk-in sites. So this is the West Yorkshire picture. So this is the most recent week compared with the last previous week in the box, the smaller box there on the bottom right. So as you can see, the grand total of people who have received a first dose is 82%, if we round it up for Wakefield. Which, as you can see, and I am a little bit competitive, I have to say. So, it's good to see that Wakefield's doing so well in terms of the vaccination programme, but we are in every cohort have the greatest uptake. So I think that's partly due to the delivery model that we've got, the way that we all work together in partnership, the roles that the COVID community champions have done in getting that message out there. That's really, really important, your roles in spreading the message amongst our communities, and the population of Wakefield for coming forward as well for the vaccine and realising how important it is to get vaccinated. So just a very big pat on the back for everybody, I think, really, in terms of that. In terms of our younger age cohorts, people do ask about that. There's a lot in the news that younger people don't come forward for the vaccine. So I just thought I'd just pop something in there. So our 40 to 40, when I say younger, it's the under 50s. I don't qualify for that anymore, sadly. But so for 40 to 49-year-olds, we've got 81% that have had a first dose already. 69% in the 30 to 39 year olds and 62% in our 18 to 29 year olds. And bearing in mind that those under 40 haven't been invited for, you know, they've only been invited over the last few weeks to come forward for a vaccine, it's still a pretty good uptake, is that. Yes, we've got some more to go, and maybe people have different levers, don't they, for coming forward for a vaccine. Maybe what Sam's just been talking about the nightclubs and large music venues and needing a double vaccination to enter those from September might be that driver for some people to come forward for a vaccine that might not have been coming forward. But I think the thing is with the younger age cohorts, they don't see themselves in an at-risk group. So I fully understand that. It's, well, why do I need a vaccine? It might give me side effects. It might make me not feel very good the day after. Various concerns. And so what we do, we try to talk to people as much as we can to understand why they might not come forward for a vaccine, what's putting them off. Sometimes it's just the fact that they're a bit scared of going on their own to a vaccination centre that seems very alien to them. So perception that they're going to get side effects for little benefit. And a lot of the time they don't like to be tied to a fixed appointment system. You know, that I'm not used to sort of having to go next Tuesday at such and such, or it might not fit their, if they're shift workers or whatever, it might just not fit their lifestyle. And the other thing that we have had is that people are saying quite a bit annoyed that they feel pressured into having to have a vaccine because they're just so they can go on holiday or go to a nightclub. So all those different emotions that we need to, and the only way that we get around that is just by talking to people. As you all know, it's about just having those conversations and just getting it out there in the open and having that conversation about it to sort of build people's confidence around having the vaccine. And sometimes they just don't know where they can get a vaccine, especially if English isn't the first language. A lot of the ways in which we invite people to a vaccine is by a text message, which tends to be in English. It's not ideal. So we're really working around, using our community assets, people out there in the communities that can support us on that to have, again, those conversations and citing pop-up clinics where and advertising them in non-English languages depending on what the demographics of that population is. So just about what we're doing lots of there's a lot of communication coming out nationally about grabbing a jab, and I was saying in Newcastle they're doing things called Vax and Wax, where younger people can go and have a vaccine and get waxed ready to go on holiday, and there's all sorts of strange things going on. We're not doing that in Wakefield at the moment, but there's lots of people just trying to do something a little bit different about inviting people in for a vaccine. What we are doing in Wakefield though is making sure that we've got lots of walk-in offers. So you don't have to be tied to a booking, you don't have to go to the faff of making a booking. As long as you're eligible, you can just turn up and have the vaccine done, and that seems to be suiting a lot of people now. We are advertising it, and I'll go into that in a moment, on social media channels, and Wakefield Council are supporting us with getting that message out in various guises as well. And so we are deciding to put the pop-ups at places where we can see that there's lower uptake, so that we can, and also away from where we've got the static sites. So our static sites are at Castleford Civic Centre, Sandal Rugby Union, St Swithun's in Eastmoor. We've also got the Morrison's car park at Dewsbury Road in Lupset, Pontefract Squash Club, and then we've got the bigger site at Navigation Walk in Wakefield at the waterfront down near the Hepworth. So, and we've got Boots in Wakefield in the Ridings, I shouldn't forget them, they've just come on board with us. So so we do have a nice array of sites, but there are some towns and villages where we're not offering that, and some people have difficulty accessing the static site, so that's where we're putting the walk-ins and pop-ups. So where can people grab that jab, or whatever we want to call it? There is a full list where people can get the first or second doses of vaccine. The fact is second doses have to, we just had a big reminder about this from the national programme, is that they must be at least 8 weeks after the first dose. This is because based on evidence, the vaccines, all types of vaccine are most effective between 8 and 12 weeks after that first dose. So we are really careful in our marketing. I think some were slipping through the net and being invited in earlier, and so we're monitoring that quite carefully with all our sites to make sure that that message is clear. The only reason why somebody would get a vaccination, a second dose, before 8 weeks would be if they are clinically vulnerable, or there's a reason why, a clinical reason why they would need to have that dose earlier. And that would be a decision that would be made on an individual basis. So there shouldn't be any general messaging saying that we are vaccinating before 8 weeks going out there. So this is the website link. So you can see, I don't know if any of you've seen this before, but this is where you can see where our sites are doing the walk-in clinics. And we've also been allowed now, we weren't allowed to by the national programme before, but also say which vaccine we've got at which day and what time as well. So as you can see, Boots are offering the three vaccines. They've got Pfizer, AstraZeneca and Moderna, and Spectrum, which is the navigation walk. They've got quite a mix of Pfizer and AstraZeneca on different days, and that tends to be the one that is open the most and for the longest, just because it is a bigger operation, is that one delivering about, they can deliver about 7,200 vaccines a week there. We've got Castleford Civic Centre, St Swithin's, Sandal Rugby Club, and as I said before, the Morrison's car park, they're doing Moderna as well as Pfizer and AstraZeneca. Pontefract Squash and Southend, sorry, that's another walk-in. So I will talk about the walk-ins in a bit. We did a South Emsall market pop-up on Monday just gone, which I shall come to. So we do have a number of pop-up clinics. So that's a picture I took on Monday morning about the South Emsall market, and I went down there just to see how things were going, and it was really popular. About 140 people came that morning to be vaccinated, a mixture of first and second doses. Some people that were well overdue for second doses but had decided to come down because we'd not done anything in South Emsall yet. And that, I think that was really important because as Anna shared the slides before, the positive test results are higher in South Emsall. So we needed to make sure that we were trying to give people better access to the vaccine. And the other thing that I saw was a lot of younger people coming with their friends. And it was almost like they felt a bit more confident to have it done with their friend rather than going on their own to a place. So again, like I say, it's all different. People have different views about or different reasons why they might or might not have the vaccine. Other places that we're exploring are Nottingley. We had not done a clinic in Nottingley. At the Ashgrove surgery, we're looking at that. Lower uptake in Airedale and Ferry Fryston. So even though we've got Castleford Civic Centre, it's still quite a way for some people to come down there. You know, they can't walk it or whatever. So we just need to go to people, I think, is the answer. We've got one in Norminton that should come up at some point as well over the next few weeks. Lupsit, Hemsworth, and we're also looking at workplaces, whether we can visit any kind of distribution centre, for example, where we've got a lot of shift workers to enable them to have the vaccine. And then we're doing some with the sort of transient populations in the homeless populations that come to community awareness programme. We've got one coming up at Sandra's Kitchen in Pontefract, which gives out food to homeless, and we also do the City of Sanctuary as well as the asylum seeker refuges as well. And then we've also been working with different faith groups. Actually, we have done one at the mosque, but we are looking at other churches and places of religion. So what can you do to help? As always, just keep on what you're doing, because you're doing a fantastic job about spreading the word. Spread the word about where our walk-ins are. Encourage people to have the vaccine. especially as Anna was saying, we've got high circulating rates of the virus out there at the moment, and just focusing on the positives that it can bring. And the problem is, I think when people do the negatives about the vaccine, that I don't know, sometimes they shout the loudest, but they are actually in the minority. The majority of people, as we've seen in Wakefield, have come forward for a vaccine. So it is just about building those positives, and the message was about join the millions across the country, wasn't it, that have had the vaccine. I was going to ask if anybody needs any support to have those conversations, and we've been working really closely with Kerry, who's on the call, around supporting people to have those conversations. And also, if you've got any information that you can share with us about the mood out there in communities around, or specific communities, and what we can do to help that and support people to have the vaccine. And then just a word about boosters. This is my final slide, I think. So the booster vaccinations, which are the third doses, they will be offered to the most vulnerable, the people that will get, are from evidence, get the worst outcomes from COVID if they catch the virus. So that is over 50s, and also people that have conditions that might put them at higher risk, and the clinically extremely vulnerable, and also the unpaid carers of those people that are vulnerable as well. And that's about 173,000 of our population. There'll also be booster vaccination offers to the frontline health and care workers as well. So we're just working out how we do that as too. So that's people working in hospitals, but also working, providing direct care to people in their own homes or in care homes. We are awaiting the guidance on it and the outcome of the trials that have been taking place around co-administering or giving at the same time the flu and the COVID vaccine. This would be better. It saves people 2 trips. It probably would give better uptake, because what we are aiming to do is have as many people have the COVID booster and the flu vaccine as we head into winter, because what we don't want is people to have flu as well as COVID. So we are awaiting the guidance on that, but the aim will be is to give flu and COVID booster at the same time where we possibly can, where it's logistically possible, and obviously if people want to have that done as well. We will deliver it in a similar way. So we'll have the static sites, and the initial conversations that I've had with all of our providers, they're all really keen to continue, which I'm absolutely happy about. And Wakefield is the only place where everybody really is on board about delivering the COVID vaccines in terms of being able to do it. So really happy that everybody is wanting to continue to provide the COVID vaccinations. And also it will be available for people that still haven't come forward. There are still people out there that either don't know how to access the vaccine, or they might be still wavering, and that's fine. And what we need to get the message out is that, you know, it's not a forever no. If you said no in March or April, you can still change your mind. You can still have access to the vaccine. This is what the offer is. You know, you can still come forward and have a first or a second dose of the vaccine. So yeah, that's just a little bit about the booster. And I think that is my presentation complete. So I'm happy to take any questions that anybody may have.
Thank you very much, Jo. I'm just reading, my screen's back on now so I can see you all. Hello everybody, and we've got a message from Lindsay Taylor Crossley saying we've had a few enquiries this week from people who don't want to have the vaccine until they are more sure of the longer term effects, and from those who cannot have the vaccine due to health restrictions. Their biggest concern at the moment has been that they are worried this choice will lead them to losing their employment, in brackets in health and social care homes, for example. Do you have any information on what's happening for these individuals, re their job security, should they still not have the vaccine?
Yeah, it's a good question, is that, Lindsay? Thank you. And there is a lot of, there was a lot of noise, wasn't there, a few weeks ago about care home staff, especially, that they were looking at bringing in mandating vaccinations in people that worked in care homes. And even in the guidance letter that came out about the booster vaccines, it did say that there would be, the NHS would be putting out a consultation, or the government, should I say, not the NHS, would be putting out a consultation about mandatory vaccinations for healthcare staff as well. So it is something that's a hot topic. It's obviously a very contentious topic. Where we've been coming from is encouraging employers to have those conversations, individual conversations with people around having the vaccination. And as more and more people have it, and just providing that reassurance that you know, there is a lot of information out there that you know, that this hasn't been tested enough, it's not gone through the right trials, and it has gone through trials, and it has gone through the right trials. It wouldn't have got a license to be vaccinated if it hadn't. It's just that it went through quickly because it was kind of all the bureaucracy that was removed to prevent, that often means that things go a little bit slower through the licensing process.
Yeah, sorry, Joe, I don't necessarily mean in terms of how quickly it happened. We've had a few people who, for example, we've got one lady whose sister had a reaction to a jab as a child, and it was the longer term consequence of that. She ended up with learning disabilities, and we have other people who have similar stories, and it's that longer term, so like years down the line, what effect it's going to have on somebody. They're the kind of people who we're getting inquiries from, and some people who just don't want it, or some people who have their own medical reasons why they're not allowed to have it, and a few who work in health and social care and are concerned now that means they're going to lose their job, and that's causing even more stress and more probably resentment from those people who are choosing not to have it already. So I just wondered if you had any information on the job side of stuff, whether we've got any kind of line that we can give to people.
At the moment, there's no mandate that people have to have the vaccine. Obviously, encourage if you're working with vulnerable people. You know, there is that almost duty to protect those people who are working alongside. But there's no mandate as such, as far as I am aware. It's got to be passed by Parliament first. Right. So there isn't anything that says that people do have to have the vaccine at this moment in time, but that may change depending on what goes through Parliament. And like I say, it is a hot topic because of healthcare staff as well. People that are exempted medically from having the vaccine, it's a tiny amount of people, to be honest, because the vaccine is safe for the vast majority of people to have. But those that would be declared medically exempt would not count in this. But again, it is about having those risk conversations with your staff in the workplace about where they work and you know, whether they are exposing, whether they work with higher risk people, whether they could be moved to a different area or something like that. I mean, I can only speak from healthcare conversations. But yeah, there's nothing in terms of your question, there's nothing at the moment that mandates it. And I would urge people, if they have got concerns, to have conversations with their GP or a healthcare professional, just to, you know, especially if it was a personal thing that affected them, because yeah, it's just about getting the facts around the vaccine, and it is you know, in the main, it is a very safe vaccine.
Thank you, Jo. We've got another question here. Do you have figures for vaccine uptake in each area? For example, Featherstone, would you be able to pull out those statistics?
I do, yes. I didn't put them in my slide, actually, and I should have done, thinking about it. Hi, Amanda. So yeah, Featherstone actually has got a very good uptake. That's why we're not doing a walk in there at the moment, because people of Featherstone have come out in the droves. I think it might have been because they all wanted to go to Wembley last weekend. But yeah, we've got a really good uptake there. We are targeted. The lowest uptake that we've got is South Emsall and Hemsworth. So that's why we started doing the walk-ins down there. Airedale Ferry Friar's got a lower uptake, but the lowest by far is Wakefield East and Wakefield North, and that is just because of the demographics of the population, a city centre population, lower deprivation, and also lots of people where English isn't their first language, lots of different cultures in that population as well. So that's where we're really focusing too. So it is just about trying to get where we can and using that data to drive the kind of response that we have.
I was just thinking that, you know, with you saying about how competitive you are, and also positive, you know, focusing on the positives. People like to know that other people are doing something and then they'll join in. So I was just thinking, if we, you know, for us particularly as the COVID champions at Featherstone Rovers, we could start a social media campaign, obviously not saying the other areas are lower, but just saying, well done Featherstone, you know, let's keep going, let's get you all vaccinated, and yeah, we love to go to Wembley.
Yeah, yeah, and I agree, because that is the thing that we are focusing on, is about the positivity and things like the you know, the 18 to 29-year-olds that have come forward. I'm absolutely made up that we've got 62% that have come forward for a first dose. And when I went to South Amstel the other day and saw everybody coming forward and they're all in the queue, it always makes me feel a bit emotional, because I think, or a bit maternal. It's like, well, you know, they're doing brilliantly, because they've got a lot of questions to ask, and they're all really good questions, but they are also willing, they know that it's the right thing to do, so that, you know, they're coming forward and having that vaccination. But what I can do, Amanda, I'll put it on the end of the slides that I'll share with Tracy. Yeah. It's like by lower super output area, as it's called, so the different wards. I can pop that on.
That's brilliant. Thank you, Jo, and you're doing a great job.
Thank you.
Thank you, ladies. We've got another question from Pam. She said it's really great that you're going to be able to do flu and COVID booster jabs at the same visit. Not only more convenient for people being vaccinated, but also should make delivery less challenging for GP surgeries. Flu jabs generally offered by surgeries. My COVID booster scheme and flu programme providers work together to avoid duplication and maximise resources.
Yeah, another great question. Thank you, Pam. And yes, that's the conversations I'm having at the moment. So I met with all the clinical directors from the primary care networks, which is the collaboration of general practice, earlier this week, to discuss how we might do that, because as you quite rightly say, flu vaccines, they were ordered, the GP practices and community pharmacies that offer flu vaccine, they put their orders in the sort of December prior to this, the year before, when they deliver the vaccines from the September. So December 2020 was when they ordered the vaccines, and they get it delivered during September 2021. And it's often delivered, as you say, from the GP practice. The COVID booster vaccine, we've been told that won't be delivered to every GP practice and every community pharmacy, because the logistics is just too difficult. And the COVID vaccine is a little bit different, and it can't be moved around lots of times. So what we are doing is having a chat with the GP practices, and already where they can, they're looking at where they can pool the vaccines together under a collaboration, so that they can, the flu vaccines, should I say, so that they can deliver it from their sites, for example, Castleford Civic Centre. But there's lots to be worked out over the next few weeks for us to make that possible. The other thing that we might be able to do is to do a hub and a spoke type thing, where the hub is, for example, I'm saying Castleford, but there are other GP sites, Castleford Civic Centre, and then what they might do is give some COVID booster vaccine to a certain GP practice when they know they're going to be doing flu on a certain day, for example. So there's lots to work out, and we're still awaiting national guidance on it, but certainly we're having those conversations to do it wherever we can, because it is going to help people much more. And until the trial outcome data comes in the next few weeks, we don't even know if we can do it yet. So we're doing some what they call planning assumptions, different scenarios of how we might do it. So it's a busy time with all this planning at the moment.
Thank you, Jo. And just a last question from Brian. 12 to 15-year-olds were mentioned. What are the plans for 16, 17-year-olds?
Yeah, thanks, Bryony. So at the moment, I should have mentioned, it's those that are turning 18 in the next 3 months will also be invited for a vaccination. as well as those 12 to 15-year-olds that are high risk. And I should say it is only the high risk 12 to 15-year-olds, not every 12 to 15-year-old that will have the vaccine. So those that are turning 18 in the next 3 months, and the reason why that is to cover off anybody who's going to university in September that's got their birthday at the end of the school year. So they've just done their A-levels assessments, and they're due to go to university in September, October. It's so that we can cover off anybody who might be doing that. That's why the national program's decided that. But I know that they are looking at 16 and 17-year-olds as well. And what they've got to do is balance up the benefit of those people having the vaccine versus any kind of side effects that they might do. And of course, as you go lower down the ages, because much younger people don't really have poor outcomes from if they catch the COVID virus, as long as they haven't got any underlying conditions, then obviously even just having a day of a headache is more, puts you more at risk than the benefit of having the vaccine. So these are the things that they're balancing up at the moment. And the science is an interesting thing, because also they've got to look at the amount that circulates, and we know that that schools and colleges are a place where the virus does spread quite easily, and especially this Delta variant that's very transmissible at the moment.
Thank you very much, Jo.
Okay.
And if anybody's got any more questions, please do feel free to email them to ccc@wakefield.gov.uk. Andrew's got his hand up, so we'll have to be really quick, Andrew, because we've just got a few more slides, but please go ahead.
It's not a question, and sorry if people have heard this already, because I mentioned it a couple of meetings over the recent days. As part of the communications plan to support vaccination, we're looking to do some videos and some voiceovers of people who's saying, I've had my vaccination so I can, whatever. So I've had my vaccination so I can care, look after those I care for, so I can see my grandkids, whatever. So just put it out there that we are looking for suggestions of people to take part in these videos. So if you have any suggestions or ideas from your contacts, if you could let us know, that'd be fantastic.
Thank you, Andrew. Our COVID champions have got lots of contacts, and I'm sure that some of them themselves would like to probably do that. So thank you very much. I'll share my screen again now. We've just got a few more slides that I will whistle through because I am conscious of time. Can you see that slides? Anybody? Have they been shared yet? Thank you.
Yeah.
Well, we did send out a survey, thank you, about gauging the mood of the community, and Jo did mention, didn't she, that if you've got any feedback to give to the CCG, please do so. So this is your opportunity. We only had a few respondents. I think there were about 10 respondents, but that information is crucial. So thank you very much to those people. And if you haven't filled the survey, and we will send you the link. So we're asking people about their own general mood and that of their own community. And as you can see, we've got a bit of a mixed bag there. 44% were very much looking forward, but that was cautiously looking forward. 33% were really worried, and 22% were not sure. And they estimated about their own community networks and community groups and organisations. They assessed that 1% were really excited, 33% looking forward with caution, 33% not sure, and 22% worried. So that's a real mixed bag. And one of the comments that someone put on was that people have expressed being frightened that measures are lifting when numbers of cases and hospital admissions are increasing. People want to make sure they aren't in lockdown over winter again when they struggled with their mental health more. And they want to be able to have a normal Christmas, and lots of fear of people getting too close if no distancing measures or capacity limits are in place in enclosed places. And I must say, I've not actually looked forward to Christmas yet, but it's interesting that some people are already thinking, the winter months are coming up, and that's when depression and anxiety tends to get worse, doesn't it, when we're all in lockdown over Christmas. So we asked if asymptomatic testing was being done. 77% said yes, and being used appropriately. 66% didn't know, 22% said yes, and 11% said no. And then symptomatic testing, are people taking the tests? 55% yes, 11 yes but not appropriately, 22% no, and 11 don't know. So there were some comments here about personal risk assessments and what information people needed to be able to make informed choices, and they were generally around guidance and statistics, clear guidance on what we can and cannot do. And someone said case numbers and information about what will increase their risks, information on all symptoms and not just the main 4. And then we asked about your champion's role and what information you would need as champions to be able to support us. And that was clear messages to share with local people. And if we can feedback the issues local people are having and their concerns. And yes, absolutely, you can always contact us on ccc@wakefield.gov.uk to let us know about any concerns, and we'll follow them up and do our best to help you. And someone said information we have already been receiving is still useful, which is good. And then finally, there is enough information and it's now up to group leaders to instruct or consult members on the level of precautions to adopt. And that was from someone who said they hide out a community centre. So thank you very much. A couple of questions. I think we've answered some. First one is, if you have tested positive, how are you able to go abroad, as you need a negative PCR test and you can still test positive on a PCR for 90 days after? I think this might be one for you, Joe. Are you able to answer this question?
I don't think I can. I can do the second one, but the negative PCR test, I don't know. That might be an Anna answer, that one.
Right, thank you. I'll forward that for Anna to answer. Sadly, she had to rush off today because she was multitasking. And I think you've already answered the second one, Joe, but if you can just reiterate, please.
I can, yeah. So it would only be individual clinical circumstances that you would get the vaccination earlier than 8 weeks. And also, I think some exemptions like armed services personnel that might be going on operational duty can have their vaccine earlier than 8 weeks. But in the main, for the general population, we are vaccinating at 8 weeks because the evidence shows that it's most effective between 8 and 12 weeks.
Thank you very much. I've just noticed in the comment box, Andrew, that Amanda has said that they can do Featherstone Rovers. You were asking for volunteers, you've got one straight away. So thank you, Amanda, for that. And someone made a comment that about some information that we circulated earlier this week about changes to check-in regulations. And the comment was people claiming not to have the app have signed in. And this is time consuming and some venues may soon abandon it. People can also sign in using a false name, which is true. And venues that continue with check-in will then be the ones identified as spreaders. Therefore, the information harvested will be at best misleading, and there are other ramifications. I don't know, Sam, if you've got anything that you'd like to say about this, or it's just a comment.
I think she might have left. Tracy.
Right, thank you. Well, if I can get a response from that comment, I will. Just very quickly, we're on the final push now. Our department, the public health team, does have a learning and development programme every year, and you are all welcome to take part in any of those learning opportunities. And on the slide, there will be a link. Born in Wakefield is about, I think it's about support for young mums and children's early years, substance misuse, alcohol, etc. And if you click on the links, it will take you to an Eventbrite page where it will give you more information about the dates and the times, and you can book on. They're all free of charge, and you're all welcome to take part in any of those training opportunities. And finally, I don't know if Neve's still on the call, but we have a set of resources here that our comms team have prepared for us, which we will send to you. And to end on a sad note, I can't show you the video. There's a little video that's been sent from the roadmap assets. But because of Zoom and time constraints, I'm not sure that we can show you that. We are a couple of minutes over, so unless we've got any other questions or comments, I would like to thank everybody for speaking. Oh, Kerry, you've got your hand up, yeah?
I'd just like, it's an unusual last thing to mention, but I'd just like to let you know that if anyone's particularly interested in public health, especially the work that we've done during COVID, we have got an apprenticeship post currently advertised on the Wakefield jobs website. So if you've been really inspired by the work that you do, it's an entry-level post. You don't need any prior qualifications, but it does give you a fully funded university degree. So I would encourage anybody who's really interested in this work to go and look at that, and please share that around, because we're very interested to get lots of applicants. We really want the right person to work with us. Sorry to make you even more over time, Tracy.
Oh, that's absolutely fine. And I do believe I've sent an email out with that opportunity on. Hopefully you should have all received that. And I must say, it's a lovely place to work in public health. It's very interesting. So I would definitely recommend, if anybody wants to do that and study for a degree at the same time. That's awesome. So thank you for finishing on a high note, Kerry. All that remains is to say thank you, everybody, to our speakers and to all of you for participating and for sharing those important messages. Thank you very much, and see you again. Take care. Bye.